I've been getting a lot more questions about nicotine in the context of health optimization. Now, this is interesting, right? Because nicotine's been vilified for many years now because of smoking and vaping. And I totally get it. I was one of those dare kids back in the 80s that was told never to smoke, never to drink, et cetera. And of course, that doesn't work for most people. It did work for me from a smoking perspective. I never really wanted to smoke and I really never really liked it when I tried it. Nicotine itself is very different than smoking and vaping. Nicotine as a compound, is actually fantastically effective at improving memory, improving recall, improving verbal fluidity, and overall just giving you more cognitive power. In the context of health optimization medicine, this is interesting, right? Because nicotine is also a stimulant. So it's going to stimulate norepinephrine, dopamine, serotonin, and acetylcholine at the acetylcholine receptor. So it's all going to go out there. That's why you feel so good and have that capacity. But that's also very stimulating to the system. And as a result, the system is going to have to make more energy when all those neurotransmitters are hanging out, especially norepinephrine, right? And so that means that the mitochondria is going to be under more stress to make more energy. And also your cortisol level in your body, which is your stress hormone, is going to go up. Depending on the dose, of course, is all going to be dose dependent. And so that you're going to have more potential energy production, but do have the capacity to neutralize the stress that happens with energy production. And what I mean by that is that when we make ATP, our energy currency, we also make water, carbon dioxide, and we make these things called free radicals or reactive oxygen species. The body has to neutralize those over time. And if you flood the body with a stimulant and you increase energy, but you don't have enough detox capacity, that could be a problem. The cool thing about nicotine, which I think is important, is that not only is it stimulating energy production, but it's also stimulating an anti-inflammatory reflex, both with immune system activation in the brain, decreasing what's called microglia activation, which is kind of our immune cell in the brain. And also acetylcholine is our main neurotransmitter that affects the vagus nerve. That's the winding nerve that comes out of the brain and goes all up to many of your organs to give them parasympathetic or the rest and digest nervous system stimulus. So it kind of relaxes everything at the time. So that's really cool. But when I'm thinking about this in the health optimization context, I'm thinking about, can we optimize vitamin, mineral, nutrient, and cofactors, especially mitochondrial function, to truly benefit from actually adding nicotine to the system? Low doses are super safe, typically like a half a milligram, maybe up to 2 milligrams for some people if they go slowly. What I found, of course, that is better is to use that in conjunction with what's going to help you with energy production and what's also going to help you with detoxification. So you can measure in health optimization medicine, we measure organic acid testing, looking at all the intermediates that are involved in mitochondrial function, looking at macronutrients, micronutrients, antioxidants, heavy metals, all these things that are going to be involved in the production of energy and the detoxification pathways. And so you want to optimize all those, right? And you want to optimize the gut, neurotransmitters, hormones, and that's what we do in health optimization medicine, of course, with diet and lifestyle and those kinds of things as well. So it's not just looking at laboratory data without the human in front of you. But nicotine, super cool. As far as addicting capacity, vaping and smoking, you just never want to do. Large doses over about 4 to 5 milligrams per day, likely not recommended either. And maybe you can use it as an oral lozenge. We have buccal troches at prescriptions, for example, that are interesting with a couple other ingredients. Or you can try it as a patch, which would be slower acting. There's gum, there's sprays that are pure nicotine. But again, avoid nicotine in vaping or smoking because it's also combined with other additives in those products that make them more addictive. So nicotine health optimization medicine, absolutely. Low doses with supportive foundational assessments and laboratory analysis with supplementation, diet, and lifestyle things around it. It can be fantastic. I use it personally. I find that it's great. And it's also short acting. So it only lasts for a couple hours and then you're done. And no come down or crash, especially if you're well optimized or at least on that health optimization path as well.